abdominal or back pain, loss of appetite, jaundice or yellowing of the skin and eyes, nausea and vomiting. Did you know these are symptoms of pancreatic cancer? My name is Doctor.Global. Let's discuss this disease in more detail. What is pancreatic cancer? Overview. Pancreatic cancer forms in the cells of the pancreas, a gland in the abdomen that aids in digestion and produces hormones. Pancreatic cancer is the fourth most common cause of cancer death worldwide. The average age of diagnosis is 71 years for men and 75 years for women. Here are two main types of pancreatic tumors. First, pancreatic adenocarcinoma is the most common type of pancreatic cancer, accounting for around 90% of cases. It originates in the exocrine cells of the pancreas, which are responsible for producing digestive enzymes. Second, pancreatic neuroendocrine tumors, also known as islet cell tumors, represent less than 10% of all pancreatic cancers. They originate from cells that can secrete hormones into the blood. For example, insulinoma produces insulin, glucagonoma secretes glucagon, vipoma vasoactive intestinal peptide, and somatostatinoma releases somatostatin. Pancreatic neuroendocrine tumors often have an aggressive and highly malignant nature and distribute via metastases rapidly. The exact causes of pancreatic cancer are not known. However, several risk factors have been identified. Causes and risk factors: chronic pancreatitis, inflammation of pancreas, growth factors and toxins produced by inflammatory cells cause genetic damage and the uncontrolled growth of pancreatic cells. Excessive alcohol use over many years is linked to pancreatitis and pancreatic cancer. Smoking. Cigarette smokers are twice as likely to develop pancreatic cancer. Age. Most cases are diagnosed in people over 60. Gender. Pancreatic cancer is more common in men than in women. Type 2. Diabetes mellitus. Some studies have linked type 2 diabetes to pancreatic cancer. Unhealthy diet with high intake of butter, saturated fat, red meat, and processed foods. Hereditary syndromes. About 10% of pancreatic cancers are hereditary. Symptoms. The symptoms experienced can vary depending on whether the tumor is located in the pancreatic tail, body, or head. Tumors in the pancreatic head tend to cause more symptoms than those in the body or tail because they may press on the bile duct or pancreatic duct. Symptoms that may be experienced with pancreatic cancer include jaundice or yellowing of the skin and eyes. It is typical for pancreatic head tumors. Abdominal or back pain, unintended weight loss, loss of appetite, fatty stool, nausea and vomiting. Symptoms of new-onset diabetes such as thirst, frequent urination, and fatigue. Diagnosis. Detecting pancreatic cancer in its early stages is challenging because the pancreas is not easily felt during routine exams, and tumors are hard to see on standard imaging tests. If pancreatic cancer is suspected, providers may recommend various pancreas function tests, including imaging tests such as CT scan, MRI, PET scan, endoscopic ultrasound, biopsy, blood tests. Treatment. Surgery is the only curative treatment for pancreatic cancer, aiming to remove the tumor and some surrounding tissue. However, fewer than 20% of patients are eligible for resection because the cancer often spreads or involves major blood vessels by the time of diagnosis. Resectable or localized pancreatic cancer accounts for only about 10 to 15% of cases. It does not affect major blood vessels, so it can be surgically removed. Tumors in the pancreatic head are removed using a technique called a pancreatoduodenectomy, also known as the Whipple procedure. In a pancreatoduodenectomy, the head of the pancreas is removed along with the duodenum, gallbladder, part of the stomach, and part of the bile duct. Tumors in the pancreatic body or tail are removed by distal pancreatectomy, which involves resection of the body and tail of the pancreas as well as the spleen. Pancreatic cancer is treated in hundreds of clinics worldwide using various approaches and equipment. However, not everyone knows that the cost of treatment in different countries can vary widely, even with the same high level of quality. For example, Whipple procedure or distal pancreatectomy, can cost twice as much in India and Israel as in Bulgaria and Belarus, but half as much as in Belgium and South Korea. In order to find the appropriate treatment conditions in advanced clinics around the world, we created the Doctor.Global service. The platform is designed to help people get a second or third opinion, choose the best clinic location, or find the right cost and treatment date. We act as an involved mediator, helping to obtain comprehensive information from clinics, translating and organizing the patient's medical records in any language, and enabling the patient to make a meaningful choice of clinic or doctor. Follow the QR code link and describe your case. We will contact you back for confirmation and immediately start searching for treatment options. Considering all your wishes, nothing is more valuable and important to us than your health. Now, back to the treatment. During resection of the tumor, lymphadenectomy, removal of nearby lymph nodes, is also carried out. A minimum of 15 lymph nodes are removed and examined after the operation to see if cancer has spread. After surgical resection, patients usually receive adjuvant chemotherapy. Borderline resectable pancreatic cancer has grown into a major blood vessel or nearby tissue or organs. Complete surgical removal is possible, but neoadjuvant chemotherapy, that means given before surgery, comes first to reduce tumor size. Locally advanced pancreatic cancer cannot be surgically removed, as it has grown into or close to nearby blood vessels. There is a high risk of vascular damage during the procedure. Thus, chemotherapy or stereotactic body radiation is used. Treatment for locally advanced pancreatic cancer typically just manages the disease temporarily rather than curing it entirely. Cancer, that begins in the pancreas, spreads to other organs, usually to the lung, liver, abdominal cavity, and brain, is known as metastatic pancreatic cancer. Treatment for metastatic pancreatic cancer typically includes chemotherapy, targeted therapy, and supportive care to manage symptoms and improve quality of life. Prognosis and follow-up care. According to the American Society of Clinical Oncology, the 5-year survival rates for pancreatic cancer are 44% for early-stage cancer, 15% for borderline resectable and locally advanced pancreatic cancer, and only 3% for metastatic cancer. Follow-up visits every 3 to 6 months are recommended for blood tests and monitoring liver and kidney functions. For metastatic pancreatic cancer, a CT scan or other imaging is done every 2 or 3 months to evaluate treatment effectiveness. Hope you've learned something useful today. Do not forget to like this video and share with your friends. We sincerely wish good health and success to all of you.